We're calling the meeting to order. I have about 9:02. I'm not sure. So first item, first of all, welcome everyone, those who could make it in person and those who are remote. Review and approve the minutes of March 11. Those were sent out perhaps a week ago, extensive minutes. Thank you, Jane. Are there any comments or corrections on them?
I move that we accept the minutes as submitted.
Is there a second?
Second.
Second, okay. It's been moved and seconded. Any discussion?
I have a question.
Yes.
One of the things that we have is that when we get our minutes approved, we don't necessarily get a copy of the minutes that don't say draft electronically. And I need to have them.
Yes.
I need to have an approved version to post, so that's why ours hasn't been posted.
All right, I will send out approved minutes,
So
and they are on our website, but what I'll do is I'll send you guys all the links, and
That
then
would be-
in the future, send it to you.
Okay, great,
Yeah,
thank you.
So noted.
And I have a question about the minutes, because we are getting into such detail, and because this is such a collaborative group, I have been doing quite detailed. I'm okay with doing less detail, but in the future, but while we're still kind of building and like deciding what our priorities are, that's the approach I've taken. So at any point, if you guys are like 2 pages, Jane, front and back, that's it, I will switch over. So
From my point of view, I think it's extremely important that there be a pretty thorough record of the decisions we're making, how we're deliberating, what we're thinking about. It is a new organization, but even afterward, it's the only record that survives 20 years from now when they say, what were they doing? Somebody's going to do the history of this movement at some point, and having a good record isn't, I think, really important.
I think providing you stick to what you already do, which is you don't record personal comments or identify people. It's a motion that and discussion followed. This was the discussion, but you don't necessarily have to identify people because that gets you in trouble 20 years later.
Yeah. Okay.
Yeah, so
Or
we'll update
5.
the minutes, and we should probably send out the link to the sub page right now, because there's a good inventory, even though we have to put our agenda on there. You know, it's posted at all town halls. We have to update our sub page on that next time. But we do, Jane has put all the agendas and minutes into the subcategory.
Right, if
And
we
we'll
could
update
have
them.
just if we could, could we work out a link
then you could
that I can just have that link posted and then I don't have to post them every month. That would be great.
Yeah,
Because
Perfect.
that's a great, I'll
Yeah,
send out the
okay.
link, and then if you could get the link on your website, then you wouldn't have to constantly be, as soon as we post it,
It's
It'll be-
posted. That's great.
That's a
Perfect.
great idea.
That's great. So that, because we have a Board of Health page and under it, I have
Perfect.
Southern Berkshire Health Collaborative. and-
Nice.
Yep, great.
Excellent.
Okay, we need a vote on this motion. All those in favor?
Aye.
Aye. Any opposition? I don't hear any votes from that end. I hope we have approval.
Yes,
Perfect. Thank you.
Thank yes.
Okay.
yes,
Thank you. Anyone opposed? Motion passed. All right. Item number 2, topics for discussion, the IMA.
Yes.
Next step.
So thank you, everyone, for all your leadership on getting the intermunicipal agreement movement through your select board and board of health. We are almost at the finish line. We have 3 towns left, Great Barrington, Alford, and New Marlboro. I don't anticipate any challenges. Jane's navigating her town of Alford. We're meeting with the Board of Selectmen for New Marlboro on Monday. We've been communicating with Mari, who's the town administrator. I think the select board has a couple basic questions, but I think it'll be fine. And hopefully we can wrap this up in the next month. And I think it's an testament of the leadership that all the membership brings to the table. You know, I every time I get involved with an IMA, it always feels like a very heavy lift. And I'm astounded how quickly how we've come, and I think we just moved this along like in February.
But I think having the review by KP Law, having the presentation by, what's her name?
Cheryl,
Cheryl
that's what I sent out.
Right, exactly.
And I have to say, they were fodder.
Yeah,
Any
yeah.
opposition was fodder
Yeah.
because she covered it so well.
Right. Right. So I think you prepped everything really well. The state did, and it's terrific.
So yeah, hopefully, this time next month will be just about wrapped up, and then we can kind of move on to just, more of a nice, fun things and not work on heavy lift operations, but that'd be good. It's a really good IMA. I think it's very town friendly, doesn't lock people in. It clarifies the role of the collaborative. It's a consensus body. Nobody writes grants on behalf of any other town. I think I think that what the
That was
state
a
did
big
was a
hit.
pretty good,
Mhm.
it was a pretty good thing they put together, and I appreciate the state for really providing support to us. It makes it a little bit easier.
Right.
So cool.
So who are our towns that we have now?
So we have Otis, Monterey, Lee. I'll have Lennox's in the next day or so. Stockbridge, Mount Washington, Sheffield, and then what's left is Alford, New Marlboro, and Great Barrington.
Mhm.
And that's where we are.
Great. Okay, the next item. Interesting request to add Tyringham and Sandusfield.
Yeah, so here's where we're at. So following our conversation last month, we kind of talked quite a bit regarding Tyringham and what the state's vision was of trying to get every municipality at least affiliated with a shared services grant for a lot of reasons, some ARPA funding and so on and so forth. We did have a meeting scheduled with Tyringham next Tuesday, but they pushed it out to the 26th. The nurse, Amy, Jill, Jane, and myself will attend Tyringham's meeting. I have a really good relationship with Tyringham. They're part of the Lee School District. And so we'll provide that presentation in a couple weeks in hopes that they're really interested in joining the collaborative. And then they'll go, we'll talk about the expectations of the governing board. We'll want someone at the table, and then we'll provide that
So you're-
presentation.
You're suggesting full membership like the rest of us, and we're talking then with the state about. what that
Yeah.
means.
And I think
Is this recording?
it is recording.
Okay, great.
Yeah, so Mike did mention that if a new town joins the collaborative that's not captured by another PHE grant, there's potential funding. I don't think it would be a lot. And I don't think, and we've met yesterday as a team, we wouldn't think that providing the services to Tyringham would be a significant lift. It's right next to Lee. There's not a lot of communicable diseases. It's a small population. We're already preparing flu clinics anyway for these school systems.
Mhm.
And so we'll work with them. But I think, if I recall, the conversations last month is, we had this conversation about like affiliate membership, what that would look like. Could we provide, contract out for limited services? I felt, and correct me if I'm wrong, I felt the consensus being, look, we want people at the table. We want people to be involved in this collaborative. And I think, if they're going to sign an IMA, and in order to get DPH funding to get the full benefit of the collaborative, they're going to have to sign the IMA. The DPH won't give the collaborative funding unless they sign off an IMA, in which the IMA says there's a governing board and delegates and all this other stuff. So we would want some type of commitment. And I really feel like after July, and it's another topic I'll bring up later, we're meeting monthly because there's so much going on. But I think we're going to get into like a maintenance zone at some point. And the IMA says to meet quarterly or more if we need to. I don't think as we move along, there'll be a significant lift on commitment of time.
The other side of the coin, though, was we did not want to dilute the capacity we have.
Right.
Well, I think that was one of the things that we did talk about, was that anybody who signs after our initial group here, and I guess that would include Tyringham and Sandusfield. I don't know if you want to put a time limit on it, but what we said was that the original members who signed, whatever project they were in, they get to do, and the next project, the new people get to sign into. Because we don't want to dilute what other town, we made a commitment to our town for X.
Yeah.
So we don't want to have to go back to our towns, because that really won't go over well.
No, we won't.
And say,
we
well,
won't do
we're
that.
gonna, so as long as that's a policy, I think the whole point about them being full members for ongoing projects is, and our base services, which is technical assistance and, all of that, that is sort of offered to everybody within the IMA, it's appropriate for that to be extended to them.
The good news for Terringham, though, is that the state's willing to give us capacity dollars,
Right,
at least for
right.
that town.
Right.
And so that, and then we've talked to, Jane, Jill, and Amy about what type of, capacity they would
Well, if
need.
we can maintain the capacity for the towns that have already committed, then I
Yeah.
absolutely have no problem with
But I
that.
think there's another angle to this, which is important. The fact that we're allowing, or I think will allow Terringham in with resources.
Yeah,
The idea of, I think that sets a positive precedent.
yes.
Good point.
That as we're allowing others in, we have a precedent. Yes, but we need the resources.
Right.
So whether that comes from state, whether it comes from, I don't know what.
Yeah. And Mike's on the call too, and I don't know, like, I don't want to get into like the dollar amount that the state was thinking for what we would get for Terringham, but we can cross that road when we
Right,
get there,
right.
but
I'd love to get into that number, but because I don't know what it is either. So I'd love to hear what they're thinking, because it would make my job easier as I speak to groups like yours. But I know that when Sam says that it'll be properly capitalized, I'm sure that he's not gonna cut corners. We do have, there's plenty of money there, so.
Great.
All
Thank
right.
you, Mike.
Nobody else like that.
and
I know, it's
and then-
great. It's a great thing to hear, by the way.
Yeah,
we do
really.
have Sandusfield, and I think there might be Anina Carr from Sandusfield is on the call.
Yes,
So-
I am.
Hey, Anina,
Um,
good morning.
I'm not even on the Board of Health, but I am co-chair of the Sandusfield Council on Aging. Unfortunately, I'll probably get hung on the town square for saying this, although we don't really have a town square. But
Thank
our Board of Health is pretty much moribund and has been for several years in town. But I'm hoping after the May elections, we're going to have a new member, and that member will move this project along. We are very interested in joining your group. We are getting very poor service from our current group up in Pittsfield from Berkshire Regional Planning. And I'm enjoying listening to you guys, and just want, hopefully, you to include us as a prospective member of your group. And I want to also thank Jim for all his help. Thank you.
Yeah, and I'd rather not get into differences in groups and whatnot. I just think that the difference between, I think, Sandusfield and like Terringham is like really, they're not affiliated with anybody. They do have a contract with the Alliance because Porchlight went out of business and whatnot, but they're not a member of, I don't think they're a member of the Alliance or the Collaborative. Sandusfield, it's one of those things where like Sandusfield has some things to sort out for themselves before they could figure this out, because like they would probably have to find appropriate funding so we don't dilute services. And I don't know how that works with, I don't think the DPH would give our Collaborative funding state dollars to join our Collaborative because they're already captured into a shared services grant. But I'm working with one of the select board members to give him a broad overview of the Collaborative, just to show him the IMA. Here's the group, here's what we're intending to do, and Sandusfield is a South County town sandwiched into all our other stuff. They're part of our school districts that our nurses cover. It would make total sense to figure it out. But I think we'll do one step at a time with respect to Sandusfield, and we'll come back to the board and see what we want to do for next steps.
Right, and I think this group said rather clearly, having somebody at the table, even if they're not a member, but understanding what the objectives are, joining in the conversation, is an important way of building up public health in South County. So I certainly would encourage that, and I'm really glad to see Nina here.
Yeah, and I think, I think we all agree that, we don't want to just become a system where we just farm out services. We want a true collaborative to help individual towns grow for themselves and for the Collaborative. And I would rather not be a program where we just farm out basic services and then
Right,
no one's
that's-
at the table.
Yeah, that's not what I meant.
No, that's what,
Right,
I'm
right.
just
No, You're
clarifying.
absolutely right. I mean, as a transition, if somebody can't come in for some financial reason until the next fiscal year and they need something for 6 months, fine. I think then we can entertain that, but I agree with you. Okay,
Well, and I just want to pipe in just a little bit. I had made a map and, you know, the intention is not to continue to expand, but to do what makes sense for our region. And at the last meeting, Amy had talked about how having the schools fragmented was very difficult. And so I just wanted to make it like Sandusfield and Tyringham are both geographically make sense. So if whatever that process looks like, if we figure out a way to fold them in, I just want to make it clear that, like, at least my intention, and I don't think anyone's intention is to continue to grow, because that's not what we're about. But it is about what makes sense and like how the impact that we can make regionally, and both of those towns are.
well, I think what you're saying is that there's something to be gained by the collaborative to including them, making it easier for how we deal with the school districts and so forth. I absolutely agree with that. I'm not so sure I agree with your statement about we're not here to expand. I think over time, I don't know why we wouldn't. If we have the resources, the organizational structure,
And it makes sense.
and it makes sense.
Yeah.
Right.
But we're not here to expand our,
Willy-nilly or.
no, and we're not here to expand our personal footprint and it's difficult to, I need better words for this.
Let me chime in. Here's my
Yeah.
thought. We're building a strong foundation. We're already
Right.
there. Like, I think we're significantly further ahead than a lot of collaboratives are. So kudos to this group. You know what? We have a 10-town collaborative, possibly more, with the right resources. What we don't want to do is go down this path of geographically growing without having the appropriate
Right,
capacity and resources.
Right.
You know,
right.
the state opens up more RFR funding and says, all right, we want to, because our core function right now is public health nursing. There's so much other exploratory options if you really want to look at comprehensive public health, but we're being funded for public health nursing.
right.
Right.
They're
And
not
that's,
funding us for an inspector, by the
Right.
way. They
Right.
want
Right.
an inspector program. They're gonna have to show us the Benjamins.
right,
And
right.
if we want to expand, which makes total sense from an evolution perspective,
Yeah.
the funding has to be there and be consistent.
Right.
Right, and it's not to put money in our coffers to say, hey, look how big we are.
Right.
It's because we're giving real service
Right.
to a group that has decided within itself that this is really helping everybody in the group. And as long as we keep that, and I think this certainly our beginning group is there,
Right.
as it seems to be for a lot of things. I mean, a lot of companies and everything else think that this is what they're doing to begin with, and then it ends up changing over time. So I'd like to see us really keep that front and center.
Yeah, and we want, even from the outset, when we first started, we all had discussions about quality over quantity, right? Because that's what got us into trouble with the pandemic, is not having appropriate nursing capacity, not having, accessibility for the seniors and whatnot. I think we all did an okay job with the hand that we were dealt with a once century pandemic. But like, we wanted to build the right capacity. And that's why we structured the program to have Amy and Jill full time, to really dive deep into the wellness activities and all these other core functions that we've never had the opportunity to touch. And we can't compromise that.
No, agreed. Okay,
Okay.
moving on. Thank you very much.
Any questions from the
yeah.
people on Zoom?
Extra pages.
No. No,
Hey, Jim, can you just tell me again what exactly it is that you have? You said that you're doing nursing and no inspections at all. What did you
So-
hire?
Our program, we get 300 a year, and it's comprehensive public health nursing with a very little amount for a shared services coordinator. So Jane's full-time, but we're using other sources outside of the shared services to keep her full-time. Some of it's ARPA funding, some of it's Tri-Town money, and some of it's the shared services money. So like fundamentally, we don't even have in the PHE grant for a full-time coordinator. It's 2 full-time nurses, benefits, limited coordinator, fringe, admin, supplies, and mileage, and that's it.
Right.
So, and then we talked about this yesterday, I'm so thankful for getting 300,000 a year, but I will tell you, that's peanuts compared to what the real costs are for running a comprehensive public health program.
Mhm.
For frame of reference, and Hank, Dr. Schwerner is on the Stockbridge Board of Health. He's on the call. He knows what our Tri-Town for frame of reference, the Tri-Town operating budget is 450,000 a year, which doesn't include a nurse program, by the way, because we're utilizing the grant. Yes, we bring in a lot of revenue. We probably bring in like 350,000 a year in revenue. But like, imagine, and we're only getting 300,000 just for nursing. So if you ever want to get to a point of comprehensive programming, it's a lot more than 300K.
Mhm.
Right, and there's a lot of work to get to that.
Yeah,
In terms
right.
of how you've been able to charge.
So it's just nursing, Mike. And if you want, I mean, in my ideal dream world, I would like to get another 150K, full-time true coordinator coming right out of the grant, and then like whatever else we need that the group decides.
Right.
Rebecca?
And Mike, some of the, out of this partnership, some of the things that have come out of it is like, we have another contract with Sheffield. We applied for a grant on their behalf, so we're able to do some food inspections for them. New Marlboro, we're going to be training their inspector to do food inspections. So through this group, because we are a cohesive group, things like that and a mutual aid has been naturally coming out of it, but it's not formalized under the Public Health Excellence Grant.
Okay, because I think that we need to do something. What I'm going to just throw on the table is looking at your map, and looking at Sandusfield, looking at Tyringham. I think what we should do is if I could just make a stupid recommendation, that maybe is beyond my pay scale to do this, but I would think you would want to add Sandusfield and Tyringham, and then target the amount of money that you're going to be asking the state for doing that. Tie that to getting an inspector to be shared. I think that would expand
What kind of
the
inspector for what?
well, that's really up to you. I think it can be a food inspector. It could be somebody who does housing and goes to housing court for you. It can be, when I say inspector, I'm talking about somebody who's sort of a utility player that will go in, discover problems in housing, and take that person to court and be able to do that, get trained to do that. Or if you need somebody who, if you're falling behind on your food, which I bet you're not, but if you are, maybe you give one inspector all of your low risk food for the entire region, take that off of everybody's plate, and then that frees up a little more time for you. That's what most of the inspectors that are being hired under the grant program are following that model. It's either high risk food, low risk food, housing, whatever. Take one item off of everybody's plate and give it to this one person, and say you are responsible for it'll be 12 towns if you do it that way, but you're responsible for doing all low risk in 12 towns. Twice a year, we want reports from you on every one of the establishments that you have to inspect. And if that inspector finds that they're getting it done sooner, then you can expand that and say, all right, well, why don't you do all ethnic restaurants and low risk, because nothing's higher risk than Asian restaurants, with sushi and things of that sort. Get them trained, take something off of everybody's plate across the table. And if you add 2 towns, that's significant. And I think, this is really an issue of citizenship right now, as far as the state's concerned. We're trying to get every one of you see the board behind me. I think you've seen it before, that we're trying to get every one of these towns. And I've got to go back to that screen because I'm actually watching on a different screen here, but we want to get every one of those towns in Massachusetts signed onto a grant. That's the phone calls that I've been living with, and what I will do when I hang up with you for the rest of the day. And that shows that you're making an effort and you got to get rewarded for that. So you got to get some more money for doing it. That's the way that I'm looking at it. So I think about that model.
So to clarify, I mean, so we have Tieringham we're gonna meet with, which is not unaffiliated, which would expand. Then we still have to sort out the Sandusfield thing. Are you saying that we should work with Sam and DPH on putting a proposal together for a 12-town shared inspector and what that cost would look like? Or just two
Yeah.
towns?
No. We'd make it a 12-town model. Absolutely. I mean, the money's there. Let's take advantage of it. It's when did anyone ever tell you we have plenty of money? Nobody in this call has ever heard that before.
Well,
No.
I mean, one of my thoughts initially, and I don't know what DPH thinks, like they've just put out a 4th round of PHE funding. And it's like, like they keep going, adding more rounds and more rounds and more rounds. And like, why can't we use some of that funding to expand the initial PHE, especially when we've showed a demonstration how fast we've evolved and solidified ourselves. And, it's like, that would solve all our problems, because a few towns in the collaborative won't need like a food inspector. However, we could use some housing backup, some housing court. We're on vacation, and I would love to have like a backup inspector. I mean, I don't need one for Tri-Town per se, but like the rest of the collaborative could use someone as a
You bet.
backup and whatnot, and
So we
just
ask
as
for
a
1.5.
floater.
Yep.
Well, and I would prefer that we not only ask for if we had to get to that point, we should table this discussion on the conversation,
Right.
but I would want to put in for Jane to be full-time.
Yeah.
Yeah.
Because I'm using a chunk of Tri-Town's ARPA funding, which is
Right.
Jane's doing some Tri-Town work
Right.
for 3 years, but like, that's 3 years of ARPA funding, it's gone.
Right, but I think that plus an inspector.
Yeah.
Yeah.
But yeah, okay, so
Okay,
Mike, you've really given us some things to think about, and we will certainly take it up.
like, what's the best way to navigate the initial conversation with DPH rather than them just getting a proposal in an email?
For you to let me know what you want to do, and I will go to Sam on your behalf. I feel like that salesman that says, "Oh, let me go." The car salesman says, "I need to go talk to my sales manager and see if I can do this."
Right,
But
right.
that's kind of the position I'm in. But I have a very open door with Sam, and I think this is something that I have his exact same vision. So when I go to him and tell him this is what I think, he listens to it and usually acts on whatever it is that I'm recommending. So I think that you guys pull together what you want, and I'll work with you on it. And then I'll go to him. I'm going to let him know that we're thinking about it when I talk to him today. And I'm just, let me bounce it at him and say, hey, look, I met with them this morning again, and this is what they need. We got to make this work. They want to add 2 towns because one is getting underserved. The underserving issue is well known as I think I know that Jane and Jim know this, that the issue of being underserved by the Alliance is very well known to Sam and very concerning. So to do it, I mean, it's a no-brainer. Again, I hate to hold up maps all the time, but look, I mean, you get a town that's completely eclipsed into your area. It just makes sense to put them in there and to start delivering services to that town and to get more money to do it.
Excuse me,
Yes.
this is the first I've heard, this is Nina from Sandusfield, that the Alliance is well known for underserving towns. I am happy to hear that it's not just us. I really am. I thought perhaps
Anina,
part of the problem
not to
was
interrupt.
geographical.
No, it's not just you.
So Mike and Anita, not to interrupt, but I rather not. I don't think this governing board wants to get into other organizations. That's
Right.
not what we're here for. I think towns that feel that they need to step up for themselves to make their cases known. I don't want to go down this slippery slope because we collaborate with the Alliance and we have a pretty good relationship with them. We're
Right.
doing things.
We meet routinely.
We have a South County thing going on. I would rather not air that kind of stuff. And I think what I recommended to other people in Sandusfield and other towns, frankly, that they need to go back to their leadership and sort those issues out. And then we can figure out the collaborative. But I think, Mike, you've given us enough information and we can kind of pull our heads together and think about what makes sense. But like, that would make it a fully functioning public health program and fill in the gaps where we need it.
Absolutely.
Because like 300,000, while I think it's great, I was like, it's a good start. But like, even when we do our reporting, it's very inspector heavily driven. And it's like, they're asking inspector this, inspector that, inspector this, inspector that. And it doesn't do justice for us on our quarterly reporting to DPH, although we're reporting tons of stuff with the nursing stuff. It's just, there's not enough money
That's
to
not
pull
enough
off an
money, yeah.
inspector, I mean, with a nursing. And I think we felt really strongly that we needed 2 full-time nurses.
Nobody's regretting that.
Yeah, that's for sure. But thank you for that, Mike.
Hand raised?
No, people are
no.
just saying, Julia had to leave a
I
while
see.
ago, so, okay.
All right, thank you very much, Mike. We will take this up and figure it out.
Yeah, just let me know and I'd be happy to go talk. Let's get the ball rolling anyway.
That's great. Thank you for that, Mike. Thank you for that.
Okay.
All right.
Nursing updates, COVID update.
Amy, Joe, Jane, I don't know who wants to start.
I just, you guys get the Monday reports. As you can see, COVID cases are going up, at least the reported ones, and of course, very likely the at-home positives as well. Maybe Jill wants to talk about some of the demographics she's seen since she runs her reports every day and is actually calling people. But, just from the few calls I've made, I haven't really been hearing about people being sick, really like truly, seriously symptomatic. Most people I've talked to have already been vaxxed and boosted. So, nothing new. We know that Omicron evades a lot of those first line protections from our antibodies. So anyway, Jill, do you have anything to share about that?
Not seeing a lot of kids. Not a lot of like 19 to 40 age group, is 50 plus that we're seeing. Checking vaccination status, those that like is not populating from MIS to Maven, so I'm filling that in. A lot of like household stuff, older people. What else?
We're having a lot of people who travel.
Yeah,
It's really targeted for people who have been on airplane trips. We're up to what, 6 now in Mount Washington.
are you?
What's the
Yes.
population, 10?
Yeah. I'm telling you, that state stat is gonna be so scary for people. I can't even imagine.
6 people right now that have it?
Yep.
Oh, wow.
Yeah.
You guys are like.
We
Yeah,
are, but
right.
it was,
They're all related to travel.
they're related to, it's one family. And a person who was visiting them, but one person in the household was in the UK. Tested negative before they went, tested negative when they got there, tested negative before they left, tested negative when they got home. 48 hours later, she was positive.
Yeah.
And sick. And her husband now is really quite sick. I mean, not hospitalized type sick, but they had to go to the doctor for PCR tests. I will add, they were very frustrated that the free clinics were shut down.
But if they're sick, they can. still
Well,
get
they
the
did, but
insurance.
they
have
were,
insurance.
they did, but it was the initial, oh, what now, what do I do? Because, right? And so we got them in and we said, nope, you're good, just call your doctor, you're cool. But that's 6 of them, and that's they're in the 50 to 60 age group, and they're in the 18 to 25 age group. So that's very interesting. And then on another meeting I went to, their public health nurse was talking about the fact that they had a ton of calls a week ago, and they seem to be very closely related to people who were traveling. So, excuse me, what you've got is people, oh, we don't need masks in public places anymore. which is a really bad message. It's a really bad message from the CDC, even from the state. I mean, I know they're recommending caution. Not over your eyes,
It is
Jane.
upside
So, I think, and we're seeing a big push from the media saying, oh, this isn't so bad. Now, what you have coming out this week that I find very concerning is all of this about the fact that the extra booster is not proving to be effective. I don't know if you've been seeing this, but now it's not only on Facebook, it's on CNN, it's on all of your typical places, and we're getting bombarded. So one of the things I'd like to see is how do we get out better messages?
Yeah.
And
I think that's a great point, Ellie. There's so many questions. There's a ton of misinformation that just provides this sort of underlayer of what do I trust, right? And then there's changing information. I was looking at the news today and they're talking about XY, these other sublineages, which are essentially what happens when someone gets infected with BA2 of Omicron and BA1129. Then you've got this hybrid sublineage, and those have been happening, but people just see these. I saw a CDC thing on Facebook it made me think, oh my God. And it basically was a study of 10 people who had Delta, who then got Omicron. But the headline that CDC put on their Facebook post was recent study shows that reinfections within 90 days are possible. Well, that's a really different message. We already knew you could get Omicron after Delta because they have different mutations on their spike protein. It was not new information at all. What we are seeing is that if you have Omicron, one of those subvariants, you are well protected against the others. And that's probably what's going to keep our cases not through the roof this spring with all the unmasking and relaxation, is because so many people, conservatively, at least 25% of Berkshire County got COVID this winter. I just saw an estimate that 50% of Americans got it. So probably we're way higher than even that. Only 10% actually had it recorded with a PCR or reported antigen test. So we don't have as much information as we like, right? We're making some guesses here, and then it makes that information, distribution of information, that much more complicated. So, to your point, Ellie, the CDC isn't getting it right. The media is not quite getting it right. The state isn't really changing their message, right? Even with new information, we just have the same stuff up there on their website. So it puts a lot of pressure on us, honestly. And it's, I've so many times this pandemic, I've put so much effort into an information campaign, and then literally within the week, it has been completely different information that needs to be shared. And I've seen flyers go out from city governments that then have to be retracted. I've seen, things up on websites. It's just so hard. Anyway, tiny violin, but.
No, I remember crying one time because during the pandemic, I used to do pretty comprehensive, here's the changes, here's what you need to be doing. And I sent it out at 9 o'clock in the morning, and by 11 o'clock, everything had changed. And I was so tired. I'm not a crier, but I was so tired from getting out the information. I was yep.
Yeah.
So
yeah, you should see my emails to our webmaster.
Change this.
Sorry. Oh, I can't believe this. Oh, just wait till 4 o'clock. Yeah.
Anything else on COVID updates and whatnot?
No.
Sorry, I was just going to also say, our wastewater data hasn't been spiking. So, I think we're seeing steady increases, but pretty small so far. But then again, we only have Pittsfield data. So
yeah.
Amy, can you Amy, can you talk about the response to the masks, the N95 and the KN95 with the families and the distribution of those to?
Sure. I think I can't remember if I shared last time or not about this. Probably not. So yeah, we sent out surveys to all the schools in our catchment area. We had about almost 400 people respond. In that group, a third of people indicated that they did have a family member or loved one who was at high risk for severe COVID symptoms, so they had concern. And in that group, 7% said they had a child at school, excuse me, in the same situation. And then within that group, about 10% responded requesting free KN95 masks, either youth or adult sizes. And we had funding from the Vaccine Equity Grant to a rural vaccine equity grant to purchase youth KN95s. So we've distributed those. And then the adult ones we got free from the MEMA stockpile downsizing, I guess you'd call it. So, you know, all told, we've distributed for the schools, oh gosh, we distribute a month's worth of masks to every child, and there were over 30 kids. So, you know, whatever, you can do the math. There were like 30 masks per person. So almost 1,000. And then the, you know, we had ordered, again, from that MEMA stockpile, an initial 5,000 masks, N95s and KN95s, and we have distributed all of those at food pantries, community centers, senior centers, low-income housing, where else? VIM, trying to think. Jill and I made the rounds. Libraries. We've got these boxes set up all around South County, and people know. And so we just ordered. We have another 3,000 just arrived the other day. So we're replenishing as needed. And I'm just trying to keep that line of communication going with all those sites where people are publicly, you know, they're coming. It's open to the public, and hopefully we won't have any more shutdowns if COVID goes wild again, you know, so people know that's a place they can go. You know, I think the government was trying to use the pharmacies in that way, the private, you know, like, well, come get 2 masks at Walgreens or whatever. And there was such a minimal sort of offering that we're trying to use it in that way. And I think Rebecca had mentioned last time that Great Barrington would be receiving a number of tests, at-home tests. So, you know, with her agreement, we may use that same distribution chain to get some of those out, maybe highlighting more the food pantries and the, you know, kind of the lower income likelihood places. But
Ellie?
You just mentioned the tests, I just made a note on dating of the tests, but the tests all that went out that we distributed are up as of May 15th. So should we be putting something out on our websites that say, check the dating on your tests?
Well,
Do we have new
it's
ones?
more
too?
complicated than
Rebecca
that.
has some good information. Sorry, Kat, I'm sorry.
Okay.
Do you want
No, no, go ahead.
So I just found out last night at our board meeting that from our pediatrician doctor on the board, and so yes, I think that it's valuable to put out that these tests have expiration dates. But what Ruby had said was that they're often changing. These companies are newly developing these antigen tests, and they're constantly reevaluating what an expiration date might be. So she suggested that we should call the company to figure out if it is in fact May 15th or if they've extended it to July 15th.
Yeah.
So there's 2 things that I think we should do. I think that on the back end, we can call the company, whether it's what I'm getting from
iHealth or
exactly, I'm getting iHealth from DPH. I know you're getting Bimax now. But I do think that, because we got one complaint, this poor guy had just bought like summer supply of antigen tests from Walgreens or CVS, and he was irate when he realized that by the time he was traveling, they would all be expired, and they're $25 a pop.
Ooh.
So yeah. So, but anyway, so that's a great public message.
All right,
but
so
it
we
might
should
not
put
be
out,
as
we should put
dire as
out, we should pull our information of what we find of the companies who we call. I mean, you know, it's tough if it's a moving target and it's printed on the box.
So we maybe we can do like we can do some stuff on the back end, kind of put our heads together.
Yeah.
Maybe update like an FAQ on testing or something. to
Right.
say,
There's
like
a
this brand,
right, there's a CDC website that you should be able to go to check your company's stuff. And if not the extension there, at least they'll give you the contact where to get that information. And it is this moving target because they wanted to get this product out quickly. And so they had a minimal date on it that they knew by that time was valid, but then they kept testing it and, oh, that really wasn't the date. The date is out here. So and it could change
Right,
again.
well, I went to the CDC thing and I actually called on the iHealth, all right?
Mhm.
What's the matter?
But nobody would commit.
Oh,
So they didn't say, well, if, and I'm talking as a user, okay, of the people who call me. What they want is that if my test says May 15th, and this is my lot number, it's okay to use in July. And you know what? They will not, or at least they didn't with me, because I put it to them pretty much that way.
right.
They won't commit. I understand why, because it's a legal issue, but it puts us in a hole again. Because once again, we're in a position where we're saying, well, we don't think so, but.
But they haven't tested it in July, so they wouldn't have been able to find out if it was still good in July, because it's not July.
But what do they do? I mean, but what does the user do?
Yeah,
I mean, if you buy the milk and it says, use by.
I think we'll
Well, of
put
course, that's
together
different,
like
isn't
a FA, like a little
Mhm.
something. We can maybe put a link and see
Yeah.
if we can find something
Great.
that will exist that will keep that updated.
At least we look like we're addressing it. which
So
is
we
good.
had put together the best way to utilize a home test, because I handed a bunch out to our senior centers in Lee before we got our other ones. Maybe we can update that and just say, hey, you should check your expiration. And while we're on the subject of testing, maybe we can talk about that and
Move on to
kind of
that one.
get that out of the way.
As we're talking, can I jump in? As we're talking about FAQs, maybe this has changed and I haven't realized it, but originally antigen tests were meant to be used when you're sick.
Right.
Otherwise, their effectiveness is hit or miss. And so I don't think that folks should be hanging on to antigen tests. I think you obtain one, you purchase one when you're sick or when you actually need it. And my goal for the test that we're getting through DPH as a Band-Aid for closing down our Stop the Spread site, I want those to go out as quickly as possible. I don't want folks to just be hanging on to them. I mean, they can do that with the tests they get from their insurance companies or the federal government if they choose to, but.
Yeah, so I think we have a good network between Amy and Jill and Jane for delivering that. So there's those home tests. And also we should talk about what we've been discussing. Rebecca and I had a conversation a couple of weeks ago with the uptick. And, we do have a bunch of antigen tests at the office, and I think Amy's ordering more. So we were having a discussion internally, and then we'll bring it to the collaborative about the opportunity with certain parameters to let the Eagle know that Jill would be willing to do some testing by appointment only. And so we're going to have the Lee office, and then I was discussing with Rebecca if someone needed to have a nurse administered test, even in Sheffield, we should put our heads together on locations that Jill could go to by appointment only. And I would let the Eagle know, because each week they put out the COVID update and they have a list of all the places where people can get PCR testing and whatnot. And I would email the Eagle and say, well, the collaborative is offering specific testing for, and Amy and Jill, correct me if I'm wrong, what we discussed yesterday about what parameters we would want, because we wouldn't want symptomatic people walking into town hall being
That
tested.
was my only issue with this. I was like, I'm not gonna be able to sell that. Nobody
So-
else in
so
this
if we
building
can-
is as dedicated to
I think we
public
should
health
need
as
some-
I
So-
am, and I'm not.
So
No,
what's-
But there's outside, there's the
Yeah.
gazebo.
Yeah. So there's two asks really, is there a location in Sheffield and possibly Great Barrington that could kind of be like the three areas that Jill could go to the test? What would that look like, inside, outside? And then Amy wrote down some notes about what the parameters of the appointment by only test. So you can remind us what that?
Yeah. So, what's the actual gap? Because symptomatic people can and should get tested through their primary doctor or through the testing service. One thing I wasn't able to confirm yet. So the Fairview testing site on Main Street in Great Barrington, is that still operating or minimally, or what's changed?
The hours may
is-
have changed
Right.
slightly, but it's still operational. They're still doing PCR testing there. It's just by insurance now.
Okay, so the change is that it's no longer supported by a state funding that allows for essentially what was considered surveillance testing, right? Test anytime, test often. So that's the gap, is people who don't have a clinical reason to test. So what are the reasons people might need to test? They might be because they were exposed. And again, the insurance, I believe, is covering if you're exposed but not vaccinated, or at least they used to. They may not even cover anyone who's just exposed at this point. Does somebody know that?
I know, but it's a good.
I think that it's different. It depends on the insurance companies.
Of course.
The medical
So, right, so no set rule.
care, I
So,
think,
so the
is
one
allowed to
gap
go through
is,
the supplementals.
Probably.
oh, sure, and yeah, it might be different for those different plans people have under Medicare. So one gap is people who are exposed but not symptomatic, maybe not yet, or just currently not symptomatic. Another gap is for people who are uninsured. Now, those people, of course, tend to go to them, or, you know, they're accessing the emergency departments. My guess is that we might get, even with when we did the rapid testing in December, January, February, we had actually quite a few people come from New York and Connecticut to get tested. So my guess is we might get a number of those folks showing up because they don't have Mass Health there in those states. So second group. Third group would be travelers who otherwise would have to pay the $80 or $90 at the pharmacy, or, you know, I don't even know if the VHS sites are allowing pay for testing, if you just need a test documented. But so those are three groups. You know, the contact folks would be the most urgent in my mind. And of course, we know at-home tests are readily available at this point for most people. But, you know, what we'd be providing is the documentation of the result, which people might need. I think some employers may still want that. Schools they're not supposed to require it, but they could want it. Or the nurse might just say, you know, you need to rule it out. And some people also have trouble using the at-home tests. I think we should keep that in mind. So, you know, I know VIM is doing rapid testing at their primary site, but, you know, there might be times when and I don't know how Jill will want to do this. If she's only wanting to do office hours Monday through Friday, we might not be helping the folks who might need a test off hours, and that would be another group. I'm kind of rambling, but I think you get the general idea, which is that there's not a need, I don't think, but I think it's an important service to have available because gaps have now been created that were not there before with the end of the Stop the Spread. So.
Okay, I think we need to move on.
Sure. Yeah, and if Great Barrington and Sheffield have an idea, just circle back with Jill, because we'll want to, and I'll work with Amy and Jill and Jane on the messaging on what the parameters would be for appointment only, and then give the locations.
Right.
And then Jill can coordinate with, Rebecca and you on if you have Sheffield and Great Barrington.
Yeah.
folks in there. Okay.
I
Thank
would
you,
like to
everyone.
take a half second to thank Jill for her help with our client who had a very intractable problem with the QR code, and you were great because you walked her through. Ironically, they didn't ask for it.
Okay, well, at least they
But
had what they
nevertheless,
needed. Yeah.
They weren't,
That's good.
taken into a small room at some foreign airport. So
Good.
they were
I
thrilled.
just need one thing clarified while I have a nurse in the room. Antigen tests are not confirmed positives, is that right? Or did they change that? If so, did DPH change that? Like, if
Oh, I don't know.
Can you enter in any positives?
Yes, they go, if
They
we
go
do it,
into
we
the-
enter it into Amy's been doing it, but yeah, they get entered into the state maintenance system.
It used to be that they weren't confirmed until you went to get a PCR test, but
That was early on.
That was early
That
on.
was early on.
Yeah.
It's changed.
Oh, no, there's still probables in Maven. That has not changed. They're probables.
But they're presumed to be a positive.
Mhm.
We treat them as positive, and the only way to override a positive probable is if you get a PCR test within
Negative.
48 hours. That's negative, right?
But then that's still, so it's still suppressing the data that we get from the state in terms of our actual numbers, because they don't count probable cases.
Mhm.
Okay,
That is true. That is true.
that's unfortunate, but
There-
it's not, I think the most important thing is just the follow-up.
Yeah.
Like,
Mhm.
here are the instructions, here's what to do if you're at risk, and connecting people with treatment like monoclonal antibodies. So, but
Yeah.
just wondered if that had changed.
Okay. I've already thought of a place in Sheridan.
Okay.
2022 programming priorities.
Do you want to take that over? So part of your packet is when we're discussing about, so the DPH is at some point, when they get their act together, they're going to be requiring all collaboratives to look at its needs gap analysis, which we've already been discussing anyway. You know who's certified, who's not. And so Amy and Jill and Jane have been working on this wonderful comprehensive document based on category about what the collaborative could offer. And again, we would work with each individual town on your top priorities, but it's still in draft form. And at some point would probably have to be converted over to the DPH needs assessment document. But, it's kind of set up as SMART objectives, it's specific, measurable, time allocated. And it's really, I don't look at this as a menu of services, but like, it's sort of a snapshot based on multifaceted approaches by category on what the collaborative can offer for our community members. And I guess I'll just turn it over to the staff if they have anything else to add, but it's a work in progress, but it's very comprehensive and excited that it's hitting on all cylinders on things we've never even thought about doing. And to me, like, this is what comprehensive public health is. It's really getting into the fissures of the community that we never had access to before. And it's a work in progress, and you have things to add, work with Amy, Jill, and Jane, but it's really exciting. And, although it's draft, we share this with Rebecca and Michael, we've shared this with New Marlboro. It's like, look at, this is what the collaborative can accomplish and what our programming is.
So can we share this with our board?
I mean, just
As for
it's
their
draft.
information?
Yeah, it's
Right.
draft. It's a work in progress, and I know it's a live document, but just go into it saying it's a draft and we're still working on it, and then we'll finalize it when the DPH, it's possibly going to be the fall by the time they get the needs assessment piece out, which is part of the work plan, but I don't think they're gonna make it by June. They're understaffed and they have all new people, but similar to like the work plan, like we were months ahead of our work plan development before the DPH even gave us the template.
Right.
So it's sort of like that.
Right.
But it's a good tangible piece of evidence to show like, hey, look at, like, there's all sorts of stuff that we could be tackling, and it's a really good document.
And I think the feedback from the group that would be helpful is like to prioritize what things we wanted to work on first. So like you said, the deadline, probably that's more like goals, but like to help us figure out what our goals are gonna be. Like, for instance, the choke saver training, that's something that is already up and running. Every Monday from here until whenever, there's gonna be choke saver training to get us back up to speed on that, and so there are a lot, the blood pressure monitoring are already being done in most of the towns. But maybe one of the
Except
ideas
for the
that,
health agent.
but like one of the things that the nurses have been talking about, and I think it's a great idea, is like having, wellness clinics instead of just blood pressure, also have a wellness component. So like if it's tick-borne illness, then we would have the little tick removers possibly, and we could have some information, if we end up getting more money, maybe like next year we can enter on a tick testing program, those types of things, and like have something we're focusing in on. And I know Jill has been kind of looking at the different topics, but it would be helpful to hear back from you guys, like, what is it that you feel that are some priorities that we could start working on? I mean, we certainly have lots of good ideas, but we want to make sure that it's something that your community members would take advantage of in a positive way.
Can you just spend 1 second on the organization of this. I find it confusing. It seems,
Yeah,
what's your organizing principle?
I think that, well, I don't know, because originally I just had like, I don't know.
Okay, what it was that they identified areas, all right?
Right, but the seniors should be all together and then like the wellness should, so that was just, it was just a click of the mouse.
As you were going through, okay.
Yeah,
Right.
Okay.
Yeah, I would just regroup by category. So
Yeah,
it's,
yeah,
it's
that-
fine. It's no big deal.
And I have a housekeeping thing.
Yes.
Things that you're working on, we need to mark as draft.
Yeah.
One of the
Mhm.
problems that we are having is people circulating things
Yeah.
that are not public records. And they are coming from members of the board, going out to their friends and family.
Yeah, we can fix that.
Yeah,
So I
you know what
just,
we'll do is resort it
it's come
and
and
send it
kicked us
in
in the
draft.
teeth.
Great.
Out, and then if people want to like
Yeah.
talk to their senior centers and their
Yeah.
council on aging.
The
Okay.
watermark thing's great.
Mhm.
Yeah.
The watermark,
Right.
the watermark draft, and it goes right across every page that you put out. And then there's no question
Yeah.
as to where they come from.
Right.
But there's
You
a-
can't just block it out and make it
Yeah.
photocopy.
There's a lot in the pipeline. You know, Jill's certified as a car seat technician. We're working on a grant application up to $7,500 to purchase tons of car seats for our collaborative. So there's a lot of things going on.
Good, good.
Too much that I can even keep up on.
So if someone comes with an expired car seat,
Right.
they can go home with a new car seat.
Yes.
Wow.
And then Jill gets to like destroy the old expired one.
This also makes sure they're, properly installed, the kid fits in it correctly, and they're
Right.
not over the weight and the height limit,
Right,
especially
right.
like I went to North Adams and there was a baby that was over the height limit and over the poundage, and all the 3 car seats that they brought were all expired.
Uh-huh,
So,
right.
that's
That's a huge look for a family
low
to-
income, single mom.
Yeah.
It's a
It's
huge
scraping
lift
by,
for
yeah.
a middle income.
Yeah.
If
Yeah,
you have to have
absolutely.
3 of them.
Yeah, oh, yeah. Yeah, that was fun.
Okay.
All right.
Program and grant updates. Grant updates, you just.
Yeah, not really. It just, I think we should put our heads together on some thoughts and ideas on maybe putting forth a proposal to Mike, but
Yes.
that was kind of
Mhm.
news today.
Right,
See
right.
that one coming, but
Right.
Well, I have an update.
Mhm.
The Board of Health voted last night to move our nursing services to the collaborative.
Yay!
That's really wonderful.
Jill just ran away. Is that like,
She
is that?
was in the car with me.
Yeah, she knows.
it was, yeah, well, I wasn't gonna go to the meeting, and so Jane and Jill were going to the meeting. And like the story they were telling me, they're like, they came to town hall, the doors are locked, they're in the car. I'm like, oh my God.
Yeah,
But
I didn't
Yeah.
read it
But-
right.
but-
We're not back in person. I don't know when we will be, if ever.
But Rebecca, let us know if it makes sense to like sit down with Ruby or even Mark to talk about like big picture stuff as you move the IMA along. Let us know. We'd be more than happy to do that.
Well, definitely, the IMA is gonna have to go on a select board meeting. I missed the first part of the meeting, but we're gonna have to put that on a select board
Mhm.
meeting sooner than later. And I want all of you at the table or
Yeah.
the Zoom
Yeah.
table.
So I'm a little confused, since the grant was written with you in it, but not that aspect of service.
So let me clarify. So this is where the kind of confusion's coming from, that DPH needs to sort out. So like when we initially wrote the grant, we knew that Rebecca had a limited public health nursing contract with the Alliance.
Mhm.
But we also wrote the grant with full intention that the capacity would cover Great Barrington
Okay.
at some point in time. But I think, we're trying to be politically savvy with everybody, so there's no hurt feelings. And so we have the capacity to cover Great Barrington, majority of it covered through the grant. The outside contract dollars will only enhance Great Barrington. And
it
so,
was, sorry. go ahead.
no, that was it, yeah.
It was confusing because the Alliance also put Great Barrington on their grant application for the Public Health Excellence Grant. And I remember sitting with you and Laura in the beginning and just saying, well, it's not duplicative because we could like segregate our nursing services. One could do COVID, another could do, other nursing programs like fall prevention or whatever it is. So, but I just felt like that's probably too complicated moving forward, and it's probably best to just have one entity do all of our nursing as opposed to splitting it up.
It's an evolution, I think, like Amy and Jill are working with Peter Dilling, for example, on things behind the scenes. Like it makes sense for school districts, right? Like one of the struggles we're having with Lee Terringham is like, they both go to the same school. So what are we gonna do? Do a flu clinic for Lee residents only? And
I was not
yeah.
disagreeing.
No,
with
no,
it. I
no,
was just
just-
trying to understand when we took the position of saying we don't want our resources diluted,
Right.
is this a dilution? And no,
No.
you're saying it was written for that intention to start with.
And while I'll never notice today.
Can I add something too, real quick?
Well, go
I
ahead.
think it's actually really important. I had a similar question because I don't know the nuts and bolts of the grant and who was written into what pieces of it. It is really important to note that Great Barrington, of our current 10 collaborative towns, does have the most activity in Maven by far. And we have so far been absolved from having to deal with that, Jill and I. It is going to be an added lift for us to add that. Thankfully, where we are with COVID right now, I don't foresee any real issues with that. But I will be keeping my eye on that for sure. And if that comes to a point where we feel like we're at our limit with capacity, we probably will have to talk to Jim and sort of advocate for our group to have additional resources.
Yeah.
For example, when that was happening in the late fall, DPH did issue funds to, I know the Berkshire Regional Planning got additional funds for contact tracing. So that's the kind of thing.
Yeah.
So currently I think it's fine. It easily could go sort of sideways with our current capacity and all the towns and the other things we do too.
Yeah, and that's why, so like I'm trained on Maven, and that's
Yeah,
where I
yeah.
think having, like I'm pretty well trained coordinator. But like, I think we have plenty of capacity
Yeah,
and
yeah.
it's exciting. It's exciting to all be able to work and like on the projects and not have to parcel it out.
Yeah.
Right, and getting your position full-time would make a difference.
Geez,
Yes.
big difference.
And I'm just concerned that with everything that you and Amy do already.
Yeah.
That, we're talking a lot of outreach here.
Oh, yeah, yeah.
You guys need to let us know ahead of time when you're feeling pressured about the time, your time commitment, because how you manage what you manage already is making me a little nervous, but you guys are great.
Well,
So
and this is how I look at it from a fiscal perspective. Like we wrote Great Barrington is probably the largest community. Well, it's probably similar to Lee, I think. Lee, Lennox, Stockbridge.
Well, we'll
Great
see what the
Sheffield.
census says, but 7,000, we still are at 7,000.
Oh, so you're probably
year-round.
the highest because Lee's only like 5,800.
Oh.
Yeah, but like part of pulling Great Barrington is like the central hub in South County.
Yeah.
It makes sense.
Mhm.
While I'll never know to this date, like they may have not funded us max if Great Barrington wasn't part of that. So part of writing that grant is to demonstrate the population size for the max amount of the grant, right? But I also look at it too, it's like our everyday lives, right? We have all these things we want to do, but then we get pulled into one certain direction. Everything else sort of just becomes secondary to deal with that. But I mean, there's dollars coming through our ears from DPH. Hopefully we see more of that. And if we start to get cremated, Jill won't be doing car seat programming. We won't
right,
be
you're gonna
doing
have to have,
appointment only.
right, you're gonna have to have somebody else. do
They
that.
gave us additional dollars, although only for a certain part of the fiscal year, for Jane to be the third backup in contact tracing. So we're mindful of that. And that's where the conversation comes in with these other towns, right? And so we need to be mindful of that and whatnot. But we've purchased all our vaccines, by the way.
Yeah.
I won't even tell you the sticker price for the vaccines. You'll fall
All
off
my
the
extra
chair.
gray hairs now is
It was like
dealing with that.
it was like 60 grand for vaccines, by the way.
Can you imagine like?
So,
having
and
to
we're
press
gonna
the
get that
button
assessment.
to the $60,000
Oh,
phone?
Yes.
Your assessment.
I
The assessment to the towns for.
Oh, yeah, there's a couple towns we're still
All right,
working
all
with.
right, we're digressing.
But so yeah, anyway, that's,
Let's not
yeah,
digress.
okay.
Move on. Thank you for there being no topic under grants update. We certainly did a lot of updating. Drug take back.
Oh, yeah, so,
Pretty
this-
self-explanatory.
Yep, and so drug take back day is April 30th, but So we're hoping to kind of do a like really a push for April 30th. But then also have messaging like actually every day is Drug Take Back Day. We're gonna use that to highlight it. So came up with this flyer, gonna talk to the police department, see if they could have balloons and signs on Drug Take Back Day. Working on a radio.
Can we put this in the, what is it, weekly?
Shopper's Guide.
Shopper's Guide.
That's a great idea. And there is a budget to do that. So I've got to figure out like how much the budget is. So this is budgeted through Railroad Street Youth Project. And so we're part of a grant for them. It's one of the ways that that pays for my position. So yeah, put it in the Shopper's Guide. That's what they did last time. And then have like a radio blurbs about like, you know, just a quick one, just saying, you know, the different police department, like there's a lot of different police departments, and I'm trying to figure out a homework to be like, to find out in Southern Berkshire County, go to the, so I haven't figured out what the URL, yeah, but, so I'm really excited about this. This is really important.
This is great. This stuff has been on my counter for almost a year now to, you know, get rid of this stuff.
I
So,
constantly take the Sheffield thing and dump it in.
well, I'm never down in Sheffield anymore.
And you don't have any, yeah.
So we're just gonna do a big push on that, and then the other thing with, and then we are working on the sharps as well, so hopefully we'll have something similar to this, and maybe we'll have like a celebratory Sharps Day or something.
Weird. Okay, shared folder.
So this is a conversation that continues to stay on the agenda. Jane had some ideas about platforms for information sharing. You know, there's Google Docs, which some of us like and dislike. There's Dropbox, which anyone can access. We can set that up. But I did set up a Microsoft Teams system. So
Right,
like,
that's what I was
so how it works is we're still learning a little bit. So through Tri-Town, I have licenses through our IT people for, you know, Outlook and all the Microsoft packages and whatnot. We pay an annual year. Microsoft Teams is part of that. So I was able to set up like a team in Microsoft Teams where you can put documents in, you can look at it. You can't make adjustments on the fly like Google Docs. Google Docs, if you make a change, it automatically saves for the next person. You sort of have to download the documents and then save it. But I did mess with it a little bit.
That's almost better though,
Well,
because I think if we're changing documents, you know.
So one of the things I've done, I did send Rebecca an invite to Microsoft Teams.
Yep.
I deleted.
Let me know if it works. So it was sort of like
I thought it was junk and I.
No,
Yeah,
no.
you can reduce
Well, I
to
just send you a
spam.
text, say, hey, but I also send it to myself on my Gmail account. And so what I could do is I can send you guys an invite.
Yes.
It's not spam or junk or on half. But what you got to do is you got to open up the link, you got to register, but you don't have to put much, your name, email, and like birthday to know that you're an adult. And then you have like a password, and then you get access to the folder, and you can see all the files and stuff. You can do Teams, Zoom. It's not like a Zoom, but you can do Teams is like another opportunity for whatever. But I'm thinking if I send,
There's
like,
also a video link.
if I send you folks like an invite as a guest, I can't change you from guest to member. It's weird, but like you'll have access. So if I send maybe Pat and Ellie the same invite, if you try to navigate and see if you get yourselves in, let me know.
Okay.
We can explore that option as a file share thing. And if you want to download it for yourself, you can download it. And I know Amy's been messing with it. I've been messing with it, but I did send to myself in my Gmail and it did work. But I was like, oh, let me try Rebecca out real
Can
quick.
you send it to me?
I'll definitely resend
We
it.
actually started using this in Mount Washington among
Teams?
teams,
Yeah, okay.
among the boards.
Oh, yeah.
So that we're trying to get a way of, one of our problems has been ZBA notifying, so, you know, everybody else that something else is going on, or the Board of Health notifying somebody else that something is going on. So we were experimenting. It's not quite as easy as,
But
on the other hand, you know, it's Microsoft, so.
But the good thing is, like, once you're in, it'll say like Tri-Town Health, and then Amy created a Southern Berkshire folder. And all you do is click on it, it's got boom, all the files
Right.
just sitting right there.
Which is great, yeah.
But at least it's got a home where you have
Mhm.
access to the
Yeah.
files.
I
So
think
maybe
that's
if we
great.
explore that, maybe we can
Right.
reconvene. If that doesn't work. I've had a lot of hit and misses with Google Docs.
Yes,
and
me too.
Whatnot.
Mhm.
You and I went back and forth like hundreds of times, given edit
Right.
access, inviting Pat, she couldn't get in. I'm like, I don't know what else to
Mm-hmm.
do. Sharing the link, it was really challenging.
Right.
Well, and like Great Barrington has amazing experience with mold, right? Like. Mold. Yeah, mold.
Yes, we call her Dr. Moreau.
Yeah.
Yes,
And
I'm gonna
so-
call Dr.
so-
Moreau on this.
I'm excited because like there's subsets of like, there's pockets of specialization,
Right.
you know, and so that's the thing that excites me about that.
Just having taken the training in mold. I'll tell you, now,
It's terrifying. It's everywhere you go.
Right.
Yes.
And there's nothing you can do.
And there's nothing you can do about it.
Measure it.
Yeah.
That would be
That would be a good wellness center.
Okay.
Wait, don't remove it.
All right, so yeah, so it's a work in progress. So I'll send it to 3U. Let me know if it works,
I
and
will.
then we'll see how it goes.
Yeah, okay, community partner update.
Well,
Everybody hates it.
No, we kind of covered a lot of that
think we
with
did.
Yeah.
Sandusfield and everything, and
Right.
I only have, with the household hazardous waste collection, which I'm most of your town, well, actually all the
Yeah.
time. Sandusfield was like the last town forever, but they're part of the collective now. That'll be May 14th in Lee, pre-registration. So I did send a flyer out to like every single town. They should have. If you don't have it, let me know. That's all I got.
Okay. Upcoming events and trainings, all nice links to this. Anything you want to say particularly about any of them?
I think that the Serve Safe certification for health inspectors, so like in New Marlboro, they applied for an FDA grant, and so their new inspector that wants to be assigned is going to that. So if you have to update your Serve Safe anyway, that would be a great one to go to, I believe.
yeah, I have to, mine is expired, but because I'm in the other program, they said, don't bother doing it. But then in the meantime, I'm not certified, so I have to go to that.
I think it's good to, I think it's always good to have.
Well, I think it's good to have it. So yeah. Do we have notes on the April 7th one? Because that's gone.
And the April 4th?
Well, April 4th is recurring.
Repeated, right.
But
right,
April
right.
7th, if there are notes on what went on, that would be helpful. I couldn't, that's
can
not a
find
date
out.
that I can do.
I can find out if that's something, put on my to-do list.
But also these trainings and that sort of thing where you have like a Q&A section. It seems to me that that's something we should have comprehensive notes on to be sending out to, teams,
Right.
because you may not be able to get to that.
Yeah. And the,
I was beating my head against the wall about something else at that particular moment, so.
and we've had, as far as the choke saver, we've had incredible, like, we're filling up those slots, so
Great.
a lot of, actually, Great Barrington had done a pretty good job of like hosting these, the choke saver courses. We're getting some from Great Barrington, but, and then the other towns, it went out to Sheffield, and so hopefully we'll get everyone up to speed on that, and then in 2 years, we'll have to do it again.
Terrific. Okay, thank you. Any other, it doesn't say board member items, but I'm assuming if anybody had anything, we would take it up. The next meeting is May 13th. Maybe we'll do that all in person, well, we'll see.
Well, one thing we want to consider, my final thoughts, I'm good to go. Is I think, the remote option, I think expires July 15th. Yeah, I think people can still remote in, but you have an in-person quorum, which we really never had a problem with this group. But one of the things sorry,
No,
am I wrong on July
I don't think
15th?
it's gonna expire. I think it's
Oh,
just gonna
really?
be up for reevaluation.
Oh, okay, sorry. I saw July 15th.
You're right there.
And I hope legislation gets passed to not
Yeah.
dismiss this.
I
stuff.
would be very surprised if they take this away because it's increased public participation
Okay.
tremendously, but they do, and again, this goes back to the state guys and the DA and all of these people who make the rules, is they have to be clear
Yeah.
about things like do you have to have an in-person quorum? Because at this point, you don't, providing they are all visual at all times. Well, they're not on normal Zoom because it focuses in on
Yeah.
whoever is talking.
Well, you can change that.
Well, yeah, but boards don't, so they need that, and they need the whole thing about the voting, and of course, we're all going back to our regular town meetings.
Right.
Yeah.
So people have to understand about the fact that town meeting is a very different, it's a very different animal.
Yeah.
So we do have to be clear with our other cohorts about what the rules are. Sorry.
Speaking of town meeting, if your town thinks that they would want to do like a COVID rapid testing clinic at your town meeting, it would be good to let us know what those dates are, so that we can do that, right?
You're gonna give them the results in the middle of a vote, town meeting, and walk
Right,
in, you
and
got,
if
you
it's a
gotta
vote you
leave.
don't like,
Get out
Well,
of
this is one of the things that we're, and we're struggling with this because if they want to have it inside again.
Yeah.
And, and I love the idea of it being for us, outside on the ball field was great, and I recommended that we bring barbecue and have a good
Yeah.
dinner
And then
afterwards
make it
Get your
because.
permits though.
we just.
Well,
had an
I can
indoor
manage that.
Special town meeting and it worked
Yeah.
flawlessly as far as I'm concerned.
Right, but we need to do some healing in our
Yeah.
town, so I thought,
Every
let's
town.
extend it out
Mhm.
and have a picnic afterwards, and everybody can chill and, no drinking before the meeting.
But lots of it after.
To make some more fun.
Yeah.
My only
Okay.
question I think we want to think about over the next couple of months is, we're meeting monthly because there's like so much going on building the collaborative and like we're at a really good place. Do we want to continue monthly during the summer months? Do we want to try to go to, because once the IMA is done, we're sort of like, well, obviously outside of a proposal that we got to sort out with DPH. Do we want to stick with monthly? Do we want to go to quarterly? Because it'll be summertime and.
So
it'll be-
there's an interim step too. I think in the May meeting, we should discuss upcoming meetings put it on the agenda. But I mean, you could just go every other month for a few months and see how that went rather than quarterly. Then you're not stretching.
I
it
think
quite as
quarterly
far.
is kind of long at this
Yeah,
point.
Okay.
I do too.
Okay, something to think about. We
Right.
want to enjoy our summer. We don't want to bog you
We
down
will
and
be
whatnot.
expecting
And
snacks.
Why are you looking at me?
I will pick up your table, and your permit.
Going to be any coffee.
I'll bring bagels
And,
next
and think,
time.
and start to think about backup delegates for your town, what that would look like.
Yeah, because we've got to
Oh,
do
yeah, we
the
actually did
hours
that.
of operations.
How is that process, how does that process work? Do they have to be voted on? as
By the Board of
alternates?
Health. I think the IMA
Yeah.
says Board of Health.
Yeah.
Okay,
It can be
so
anyone.
do I have to be voted as?
No,
the
I think
participating
I think
member?
you're the primary. I would just go to your board and say, look, part of this is I'm the
Right.
primary delegate.
Okay.
Can we get someone else as a backup? You're on vacation or something like that. And I'm working on that too, a couple of my other towns. Something to think about, because the IMA, we'll want to try to stick to the IMA. It talks about primaries and delegates, and I'll give you a roster, of who's currently, it was a cobbled up group, a bunch of us got together and just made it happen. And, but, we'll want to think about like delegates later on in case something comes up.
Absolutely.
And just on this, there's one little typo, of course, I didn't notice, so I did 20 copies. So I'm gonna send this out digitally.
Okay.
Pat's gonna find the typo for me. She'll find it. I'm giving you 5 minutes.
Okay, motion to adjourn,
So moved.
second, got it. Anybody objecting? We'll just go it that way.
Thanks, everyone.
Thank you.
Thanks,
everybody.
Hank.
Thanks.